What's up, guys? Welcome to the PT Good Podcast, where we talk all things ortho, from physical therapy to training. My name's Kane.
And my name's Mark.
All right, Mark. So, what is on the agenda for today?
All right, Kane. Today we're going to be talking about loading strategies. When we say loading strategies, we mean how we dose exercise when it comes to addressing a certain clinical presentation. Whether it's something where we're addressing a motor control deficit, like we talked about in the previous episode, or whether it's something where we're looking to improve an impairment such as strength or power. So, Kane, why don't you start us off? Just give us a general idea of how you dose for specific goals.
Mark, I thought we knew that everyone just dosed with 3 sets of 10.
Yeah, you just do it. Time. You do a couple, 30 in a row. How about 20? Ooh, 20.
Wow, really spicing things up
getting
there.
Crazy.
Wow. So the way that I usually dose loading depends on a couple of things. If it is something that is motor control, like the first time that they're learning a pattern, I keep it pretty low repetitions because I want to make sure that they're able to perform the movement well and they aren't limited by fatigue. Right? If you're trying to teach someone a new pattern, the big thing is you do not want there to be a limiting factor outside of their ability to just execute the pattern that you want them to perform. It shouldn't be an issue with with an actual load, the weight itself. There shouldn't be an issue with fatigue or anything like that. Once they've learned the pattern and they're able to execute it with no limiting factors, that's where you can start to make it a little bit more challenging. Now you start to give them a little bit more resistance, or you can have them perform it for more repetitions. So for something like that, I'm usually shooting anywhere from 6 to 8 reps, somewhere around there, just because I want to see if it's something that continues to improve over time, with additional reps, because sure, someone might be able to do it with for the first 1 or 2 reps with cueing. You don't really know what happens if you take your hands off, or if you decide to tell them less things, maybe you don't give them as much cueing and see how they kind of respond with that. But that's typically what I would do for the first introduction of a motor control exercise. The other aspects or deficits that Mark mentioned, I think that those can fall similarly, but they have a little bit of a different justification, and we can discuss that in a little bit later on down the episode. But I think that for the first part, especially for motor control, it's just making sure that their quality is what matters, not their quantity.
Sure. Like you said, so we have a certain goal when we're performing this exercise, in regards to motor control. We want to make sure that goal is achieved and it's not limited by something else, right? If we're talking about building strength or endurance, we expect fatigue. When we're looking for quality of movement, at least initially, we want to enhance the quality, right? So we don't need other things getting in the way of that.
Yeah, and I think that when you mention trying to improve on strength or endurance or things like that, if you think about it, those are the things that should be your limiting factor. So if you're looking to improve strength, you're pretty much looking to ensure that, they're approaching fatigue because the load is too much, not because, I've done this and my heart is beating too fast and I can't catch my breath. That would be an endurance issue, right? So make sure that when you are addressing a specific goal, that not only does your intervention match, because that's what we talked about previously, but also that your dosing matches what exactly you're trying to do. You should always have justification for what you're how you're approaching a deficit. So if it's something that's, like I said, strength-based, they should be limited by their load. If it's something that's endurance-based, they should be limited by their endurance. And then for power, this is pretty interesting because it's more or less are they able to achieve an extra rep or two compared to their previous best when they're under a time constraint? So I think that's those are all really unique goals, but I feel like a lot of people tend to kind of group them together, or they just misdose the intervention because they just haven't really put that much consideration into what exactly the rep ranges kind of do and how exactly they can manipulate that to achieve better outcomes for their patients or for their own training if they really
Yeah,
cared.
yeah, yeah. Yeah, no, I definitely get that. I want to go back, like, so it seems like the foundation of starting to build, maybe go towards other goals is the motor control aspect, right? The movement should be done in a way in which the patient can perform it efficiently and effectively, right? So you talked about starting with lower rep ranges. What do I think I understand why you're there, but what kind of feedback are you looking to provide to the patient? What kind of feedback are you looking to get from the patient in order to know that, that is an appropriate rep range to start with? And then how do you start to build from there, from when your goal is motor control, or we'll say just movement performance?
Yeah, so there's definitely a few things that I'll check in on. Like, um, obviously, because we're worried about the quality, I don't usually have to ask the patient like, does the resistance feel right for you? Does that feel
Yeah,
heavy
yeah,
enough
yeah,
for
yeah.
you? Because we're just looking to see how are they moving. My usual questions are, how has this affected your symptoms? Has this changed your symptoms in any way, shape, or form?
Hmm.
If they are able to do something and there's less symptom presentation, awesome. Right. The second thing that I almost always ask is, do you feel more stable when you're performing this movement? And because a lot of motor control issues usually are like, okay, they're having difficulty with the sequencing of like some of their muscles working together, right?
Hmm.
Especially like, let's just use shoulder for example. There's so many different muscles there, so many different moving parts. If something doesn't work the way that it should, you're probably not going to be quite as strong. That's usually where you're going to have some issues in regards to like their symptoms flaring up again. But if they feel decreased symptom presentation, they feel like they're more stable or an improvement in their performance, you haven't really even done anything. You haven't loaded them. You haven't done anything particularly like different. You've just kind of gotten them to move a little bit better and cleaner. Once you do that, awesome. Now you can start to challenge them more. Once they've learned that pattern better, now you can actually start to push a little bit more load. Maybe you need to give them more repetitions to see how quickly they fatigue. Just because reproducing a high quality movement is like you're learning a different skill or you're relearning a skill that you haven't done in a long time.
Yeah.
You can pretty quickly fatigue someone if they aren't used to that. It's like
Yeah.
if
So,
you
yeah, go ahead.
I was just gonna say, like, if you have someone do a sit to stand and they're used to doing it a certain way, and then you correct it, and they're like, "Oh my god, this is so much harder
Right, right.
than what it was before." That's probably wise because it's
Yeah.
different than what you've been doing.
And that kind of fatigue can be like when we're talking about from a learning of movements, from a learning standpoint, when they're learning the movement, it's different. It can be maybe they're using different muscles, or are you talking about more so can it be fatiguing from a, let's just call it a mental perspective, where it's like, okay, they have to focus a lot on performing the movement a certain way because it's, whatever benefit we feel like they're going to get from it. Do you gauge it in
Yeah,
both respects?
yeah, it's
Yeah.
definitely both. To be honest with you,
For
because
sure.
like
Yep.
if they're not used to a pattern, for sure, different muscles that are required throughout the motion. Like if they're not used to activating them and utilizing them how they should, yeah, they're for sure gonna be more fatigued in that way. But
Yeah.
the other part is if a patient struggles with cueing or they aren't as familiar with like movement strategies and stuff like that, that's where the cognitive like fatigue really kicks in because like
Hmm.
most of the times oh man, this is actually something that drives me nuts. And I some patients will mention this to me too, which is like I just introduce a pattern to them and they're like, how am I doing? Does it look right? Am I doing it right? How do you fix it? And I'm like, it doesn't need to all be fixed at one time.
Yeah.
right? Like I've seen PTs that over cue, and I was definitely guilty of this before too, where I'm like, it needs to look right. I need to coach them
Right.
until
Right.
it looks right. But no, like at this point, I definitely don't do that. I just give them like 2 to 3 cues tops, and they're very simple ones. Most of the times, I am just kind of grouping things to create one particular change and seeing how that affects the rest of the pattern. And when you do that and you see that, usually you'll be able to identify like what the root cause is and where you can create the biggest amount of change with the least amount of work. When you can do
Right.
that, you simplify the process so much more for your patients, and they don't have that cognitive fatigue of, okay, well, you told me I need to push my hips back like I'm reaching for a
Yeah.
chair, but my knees also need to move forward so that I can get good quad drive. And then I need to spread my knees apart so that I don't blow out my ACL when I'm squatting. Or it's just like,
It's a lot
it
going
becomes
on.
so,
Yeah.
yeah. And then also, like, if you think about foot position and stuff like that, I don't even tell them that. Like, starting off, I'm just like, hey, just squat up and down like you're reaching for a chair. Just let me see how you move. Let me see what this looks like. And we go from there. If you start cueing right off the bat, you're probably doing a disservice and missing the boat, quite frankly, because
Sure. Yeah.
you haven't even seen how your patient moves yet. How are you going to dose them appropriately, or how are you going to cue them appropriately? Maybe they're doing things pretty well already.
Yeah.
So
Right.
I think that's super important to consider, is like just getting that baseline for your patient.
Yeah. So like you were saying in regards to overcueing, maybe it's something you're talking about knee position, hip positioning, foot position, something like that. Maybe if we just address a single thing, everything else falls in line, and then we can start to develop that movement foundation, and then we can quickly progress to the steps going on. So, how do you determine? Like we're talking about dosing for motor control. When do you determine that they're ready for more reps? When they're ready for load? When they are, ready to progress? Essentially.
Yeah, so there's a couple of things that I'll look for, which is like, are they able to perform the movement without me having to cue them like substantially? If I can just get away with 1 or 2 verbal cues and they're able to reproduce the motion that I want them to without any tactile cueing, awesome. That's like huge. Like tactile cueing is important, but it definitely is something that people can become reliant on, because you're guiding them a certain way, you're helping them move a certain way, instead of just like having them understand what it should feel like and being able to reproduce it. That's like the number one criteria that I use. If you can reproduce a pattern without me having to excessively cue or put my hands on you, like you're probably ready to progress. The second thing I'll look for is like, how consistent is their pattern? Like, are they able to perform it again and again and again? How much variation is there? If there's a lot of variation, probably not ready yet. Probably just keep going with where you're at.
Yeah.
Maybe add in a couple reps here and there just to reinforce that.
And
Because you need
variation
reps.
in that, maybe even within a single set, like some reps are good, some
Oh
aren't so
yeah.
good, and not and then maybe even within like a session where one set's good, and then maybe you come back and the other one is, they're performing different. So you're looking for consistency.
Yeah, because like
Right.
fatigue matters a whole ton. Like when you start to get tired, you just lose your faculties and you lose control
Yeah.
of a lot of things. So fatigue for our patients doesn't necessarily mean like, oh, they're huffing and puffing a whole ton, but it could just be that, oh, they've done enough that those muscles are they don't want to perform the action that you want them to perform anymore.
Yeah.
So that's totally fine, but you just have to know how to gauge that appropriately. And I think that when you're able to do that, it just makes being able to give them a weight a whole lot easier, because it shouldn't feel like a tremendous change. When you progress someone, it really should not be like, oh wow, that was a big change. Like that's a lot heavier. It should pretty much be like, oh, okay, it feels virtually the same. It
What do
can
you
be a
mean the
little bit more
same?
challenging.
Yeah. Okay. So
Like
Similarly,
difficulty
yeah,
should not be a huge jump up. It should
yeah,
be
okay,
like a very
right,
mild increase, especially if you're still looking to hit like quality of their
right,
motion.
right.
And then as that starts to get better and better, then once it's ingrained, you can make bigger
Hmm.
jumps. You can
Yeah,
make it a lot quite
for
a bit
sure.
harder.
Okay. So similarly to when you were talking about manipulating variables in terms of improving the quality of the movement, when you're starting to progress and you're adding, resistance or you're adding repetition, set volume, whatever it is, right? It's not a huge drastic change. We still want to, we still want the quality of movement, and we don't need to introduce such a huge change that we are sacrificing quality, right? And maybe even we want some room to progress. It doesn't have to be a huge change all at once. We can start to build from the foundation that you've built with the movement quality.
Yeah, for sure. Like
Okay.
if you to me it's like if you start to abandon the quality of a motion, that's where you're going to notice a pretty substantial drop off in performance
Yes. Yeah.
both for like motor control but especially for strength. You started to really load them, and even more
Hmm.
so for power production, because now you're not only loading them, now you're asking them to do it
Yeah.
fast.
And when you say
And so
quality
that
of movement, like we've already found out that the way that this person's performing the movement is best suited for them from a performance standpoint. So you're saying, like, we start to add these variables and the quality goes down, they're not moving in the pattern that is best for them. Yeah, we can't expect the other things, like you said, strength and power production, to continue to improve when they're not performing it in the way that's best suited for them.
Sure, for sure. Now, Mark, when you we talked a little bit about motor control here already. So, how does loading for motor control versus for generalized strengthening differ for you? Like what are you looking for? How do you kind of progress your patients, and how exactly do you change your loading parameters to accomplish those goals?
Yeah, so I'm definitely, when it comes to motor control, I'm definitely on the lower rep side. Depending on the person, depending on their level of conditioning, depending on the exercise, the movement that's being performed, I may even have them start with triples. Like, here, we're going to do 6 sets of 3 today. And maybe it's just like, I'm not looking for power at this point, but maybe it's just like, let's use jumping as an example. Okay. All I want you to focus on is, landing this way, right? Or when you squat down, getting to this depth, coming back up. I'm not looking for, it doesn't need to be a lot of reps at once, right? So maybe initially, when I'm looking for task performance, it's something where we're doing sets of 3. And, there doesn't need to be a certain amount of time in between, but we're going to continue to build that pattern with lower reps. And we can still get the volume through multiple sets, but I want them to focus on performing the task a certain way. So like you talked about, maybe, sets of 5, something like that. Yeah, depending on the task, maybe we're starting a little bit lower. The way I start to build from that is, in terms of, you said you just talked about consistency. Maybe I'm adding reps, maybe I'm adding sets, or if I'm starting at triples, I'm typically going to add more reps and then take the sets down to see if they can perform the movement within the parameters that we established consistently with um, more repetitions within a single set versus spreading it out over multiple sets. So then they're required to concentrate on the movement for a longer period of time, right? It takes longer to complete more reps. So there's a little bit more focus there. Once they're consistent enough in that regards, then we can start to think about adding other variables, depending on what they have to do. Maybe you said we're adding some resistance, some external resistance, some load. Maybe we are adding a different variable to the movement, such as height or distance, yeah, whatever it may be, right? Now, when we're talking from a strength perspective, again, it depends where the person's at. I want to build a baseline. I'm looking to load them appropriately, so depending on where the person's at, it's different. They need to have the movement down. We expect maybe some change in the movement as they fatigue, but again, there's parameters we're working within, right? If they came in squatting a certain way and it felt bad for them, it was painful, and we start to load them up. Let's say we're doing 4 sets of 7, something like that. Maybe I expect towards the last set, or the last couple reps of the last set, that their movement changes a little bit, but it can't be, the quality of the movement can't change so much that it's painful again, or it's changed to the point where you said the quality's changed to the point where we're not performing at the level where we need to be, right? So there's a little bit of variability in terms of like where the acceptable range lies, but it's something to keep in mind as we're progressing to that strength standpoint. So yeah, I mean, when we're looking to progress for strength, different variables we can manipulate: volume, the intensity, when it comes to external resistance, things like that. But especially if we're looking for performance, and more so if pain was limiting and it's not anymore, the quality of the movement has to fall within those parameters.
Yeah, I think it's really interesting that that you said that, because it's like quality definitely is important, because when we go from motor control, that the whole point of that is primarily focusing on the quality, right? Like
Yeah,
we understand that. But then when we go to strength or power production and stuff, most of the times quality starts to drop and it just goes to the wayside. But in reality, you are trying to practice a pattern again and again to become more efficient at it. And that way you can become stronger at it too.
right.
Right. So you want to prioritize that, the quality, because if that starts to go, then your foundation that you've worked so hard to build for that patient, that starts to go.
There's no,
And
yeah.
so
Well, I spend the time building it if you're just gonna, you said it's gonna go by the wayside.
yeah, so like that to me has never really made a whole bunch of sense. So understanding when the acceptable level of like quality degradation is, or like what the acceptable level of fatigue is for the patient, I think those are all really important to understand. The same thing goes like if you think about it for like your own training, like if you do a set of 10 for like pull-ups and your last like 2 reps, like you're getting halfway up, you're swinging, the pull is completely different than what your first few reps are. Is it really going to be as effective as if you just stuck with the quality of the movement and
Yeah.
actually grinded out those reps better? It's the same exact kind of concept here. Like you have to have some, and at least it's subjective here, obviously, but you
Mhm.
need to have some cutoff, right? For some standard for
Yes,
the
yeah,
quality and how it's going to look. So I thought that that was really, really nice to note. But the
Yeah.
one thing I wanted to mention is when I give my patients like a cue, or like Mark was saying that how if he's really focusing on the quality of something and when he's loading a patient, that he stays with the lower repetitions and stuff. What I'll usually do, and I've noticed this works super well for athletes, especially for like plyometrics and stuff, is when I load them, I give them a 1 or 2 objectives, and that's it. This is all you are focusing on. This is like we are limiting the amount of reps that you're getting, so you need to make these count. So when you have that kind of constraint, when it's not just like, oh, I need to just do 10 reps of this and then we'll call it a day, it becomes like, oh, how can I showcase my skill here? How can I show that I've learned and picked up on the cues that Kane or Mark wants me to do here effectively and efficiently? And within just a few repetitions, that puts a lot more pressure on them to be able to perform. And I've noticed that because there's only like 1 or 2 cues I want them to focus on for that set, or maybe for that session, you get way better results so much faster than trying to correct everything all at once. It's
Yeah.
just so much more like palatable for them.
Yeah, I like when you said the pressure to perform, because I recently I was helping someone with a knee injury. We're loading a little bit more, we're getting back to jumping, and our session was, we were just starting, right? So we started with sets of 3. I think maybe we did 6 or 7 sets of 3, and it's a much different response from the patient, where okay, you're gonna do 3 reps, and they're looking at me like, okay, 3, sure, but I want you to do it a certain way. And then when they're preparing to do the set, they're kind of looking around, got their hands going, like rubbing their knees, and they're looking at me, and I'm like, all right, man, you could go ahead, do it, right? But there's a lot going on in their mind. It's like, I got, this is what I'm supposed to focus on. This is how I'm supposed to do it. Not that I gave them a ton of cues, folks, but it's a lot of mental fatigue. It's a lot of work to perform a task a certain way when, without having that pattern built, right? Compared to say, okay, here, just do 10 of these. Okay, I'm going to do 10. I can get to that number doing this however I need to. I'm going to do 10, right? So it's certainly like keeping that mental fatigue, especially when we're building the foundation of a movement in the back of your mind, and knowing how to dose that appropriately is huge. We talked about building that foundation. What do you want? We talked about, how we're dosing for motor control. And so again, when we talk about motor control, at least so far, we're talking about performance, and we're talking about making sure that the person has this movement built, and we've determined that moving this way is beneficial for them whether it's from a performance or pain standpoint. You've got this foundation built. Where do you start to go? Let's say the person's goal is getting stronger, or we can get power in with this. Where do you start loading wise, right? Do you have them follow like a certain level of periodization? Do you have them follow, let's say a certain program, or is it something, do you use RPE? How do you start to measure fatigue, and what does your progression look like?
Yeah, so we talked about this previously. I use double progression for the most part for a lot of my patients.
And yourself
double progression.
Too, right?
Oh yeah, for sure.
Yeah.
So double progression, for those who are unfamiliar with it, is you have a rep range. So let's say you give someone, my usual rep range is 10 to 15. So if they are able to do 3 sets of 10 or anything along the lines of that, right? Like then it's like, okay, we stick with this weight. The next time they come in, I have them do 12 reps. Next time they come in, I have them do 15 reps. If they're able to get to 3 sets of 15, that's when I know, okay, I'm going to bump up their weight, and then I expect to drop off in reps. So you're pretty much adjusting how many reps they're doing and their load that the load that they're using, depending on their performance and how they're continuing to progress. I find that to be very, very helpful for a lot of people, just because it starts to give you that structure of when do I move you up, because there are so many times where I just see PTs and they are just like stuck doing 3 sets of 10. Oh, you used this weight last week. Okay, keep using it. And then how do I know like when to progress them? Like when do you make that jump up? And so I think that using double progression at least gives you a system to continue to make things harder for your patient, but in a more systematic way. I tend not to use RPE or RIR or any of those things for patients, because there's too big of a discrepancy for someone in regards to their fatigue. Like if it were someone that I've been working with for a long period of time, they understand what this is, they know how to push themselves, that's awesome. It makes it a lot easier to utilize that. But for some patients, they're just like, I can't do anymore. And I'm like, you are at you have like 10 RIR. Like you can for sure keep going.
It's pretty subjective, right?
Yeah. So I almost never utilize that for my patients. I use it in my own personal life or with people that I'm training, but I think it just does not have a super effective place in outpatient PT, unless it's with maybe athletes or someone who's just well trained and has been training for a long time. They understand these things. What about for yourself? What is your usual strategy that you'll go to for this?
Yeah, I definitely try and keep it objective. So it's hard to, so you definitely get a higher degree of subjectivity if you go RPE or IR, right? It's kind of, especially if it's someone who's not used to a certain style of training, then they're going to start to feel fatigue or burning in their muscles, and they're going to be like, all right, I guess, I'm done. So I try to objectify it, right? It's a kind of like a loose, we can call it a linear progression type thing, right? It's just kind of, I spread it out over time depending on the patient, right? So if they're doing a certain amount of sets and reps and they've gotten to, using a certain weight, maybe next session I just increase the weight. They stick with that same amount of volume, right? Yeah, it's pretty much just a increase in volume. I mean, maybe it's similar to the double progression, just it's different, done slightly differently, I guess. Volume stays the same. As long as I can tolerate that amount of volume, I'll keep going with the weight. And then we just start to, once they can't perform that amount of volume with a certain amount of weight, we can start to drop volume so we can keep increasing the intensity. Yeah, that's kind of what I go with.
You are literally doing double progression, but just with more steps.
Yeah, listen, man. It's just how it goes. So like the only thing with that is like it's you had to find where you start in terms of like your sets and reps, right? So typically, if strength is the goal, I mean, this is going to be a topic we talk about. I don't see an issue with starting with tens, right? Tens, maybe like 12s. It gives us room to start to. We're still getting that strength-based stimulus, right? But it gives us room to decrease, right? Especially it depends on the movement, it depends where the person's at. But then over time, the expectation is that the total volume is going to drop, right, as the resistance increases. But I want to get as much out of that baseline volume as I can before I start to increase the resistance or before I start to drop the volume.
Yeah, and I think that's
but at least between you and I, like I think the objectivity is big, right? We want numbers. We want to say, hey, when we started, you were doing a total amount of 30 reps within the session with 95 pounds. Now, we've backed down a little bit. Maybe we started at 310s. We're back now. We're down to 5.5s, but you're doing another 60. You got another 60 pounds in the bar, something like that, right? So yeah, as long as there's improvement and we can objectify it, I think at least in the rehab world, RP RR might have its place, but I think the objectivity certainly gives us a little bit more in terms of measuring and be able to gauge progress.
Sure. Now, I have always wondered, and we joked about this in the beginning, but like, why do you think people stick with the 2 or 3 sets of 10?
Yeah. Well, now I just want to say
for every exercise.
Yeah, for every, because those rep ranges can certainly have their place, right? As long as it's appropriate. Would you agree?
Mm-hmm.
Yeah. So like, I mean, I don't want to. I know there's some people who just bash on that just generally without giving any kind of context, and they're just like, oh, 3x10, you do this, and it's like, listen, that can be appropriate. We can work with that, right? Depending on the goal, depending on if we're achieving what we want to with that dosage. But I think a reason why it's universally implemented for any kind of exercise, any kind of goal, is because it's kind of, I don't want to say it's like your mid-range intensity and volume, because typically when it's implemented, it's not the right amount of volume and it's not the right amount of intensity. This is the conclusion I've come to. The patient spends enough time performing that movement where their perception is that they've got something out of it. That makes sense? And it gives the therapist enough time that the person they can give enough exercises with that amount of volume where the patient spends enough time in the clinic that they can, bill for that amount of time session wise, right? I don't think listen, that's what I'm sticking with. I don't think that that amount of dosage is prescribed with any really specific goal in mind besides I want this person to do this, and it's easy to understand. You said that you're kind of within that mid-range. It takes a little bit of time for the person to complete the exercise, and yeah, that's it. Like I said, I don't know, when it's implemented correctly, you can achieve whatever goal you're looking to achieve out of it. But I think most people just give it because it's they just default to that almost. It's just kind of there. Like I said, the patient spends time doing it. Takes them a minute or two, they've done their warm up that takes 5 minutes. You give them 6 or 7 exercises that takes that amount of time. Then you got your 25 minutes. And you do a little bit of manuals. That's 10. You got your session, right? All right, that's what I think. Where are you at? Where are you at? Do you have a a different interpretation of this in your experience, or? And I don't think people are giving this in a harmful way. I think it's just 3 10s. It makes sense. It's just kind of like you just the person does it, right? They feel like they're doing something, and it takes them a certain amount of time. So, but yeah, what do you think, Kane?
I do agree with some parts of what you said. I think that 2 or 3 sets of 10 is the standard for a reason, and it's because it just tends to work for most movement patterns where you're not overly loading them, and it also hasn't become just like cardiovascular endurance at that point, right? So I think that gives you enough repetitions,
saying, right?
Yeah. So it gives you enough repetitions to improve on the quality of it. It gives you enough volume so that you're actually like getting some work done, and it's low enough that you're continuing to build strength. It is the universal hypertrophy volume for a reason, right? Like most of the times it's like 8 to 12. I extend it up to 8 to 15, and I think that you can use that for almost every single exercise. You can honestly drop it down to 6 to 15 if you really wanted to, and that's totally fine. But I think that is going a little bit further into the weeds of how much that matters, right?
For sure.
But I think that 3 sets of 10. This isn't something that I'm necessarily bashing on. I just wish that there was a little bit more thought process behind it, or justification, for example. Because like if you give 3 sets of 10, like you can go above that. You can go below that. Don't be afraid to change your volume to be more appropriate. And I think that's really what we're trying to get across here is just making sure that your justification for why you're doing stuff makes sense and that it lines up. Because at least when I give an exercise and the dosing for the volume, I almost always will tell the patient. Rarely do I actually tell a patient 3 sets of X. Like I don't just give them one set number unless there's a specific goal that I have in mind. Like they haven't progressed at all. So I'm like, hey, you need to do this. But even then I'll usually give them a range. So usually it's like, I'll say, hey, do 3 rounds, 10 to 15, do what you can do. And then we'll see where you're at. And then after that, their effort doesn't really change a whole lot from session to session. It stays pretty consistent. So I don't have to worry about that a whole ton. The next time they come in, they may do 12, they may do 15. Okay, it's time to bump up. But it's when a patient sticks at 3 sets of 10 for the same weight. And if I give them that option, that's where I'm like, okay, things need to change. You're doing 3 sets of 12 to 15. And the next time it's just, you're doing 3 sets of 15. And then it's go ahead.
Yeah, like even that amount of progression, we're not changing a lot. There's not a lot. It's not like there's a lot of mental effort on the therapist's part, but it's progression. All right. Like compared to if we're sticking with the same amount of volume and the same amount of resistance over time, those adaptations that we're looking for aren't going to be made. Or the lack of adaptation is going to make it hard to adapt going forward, right? There's not, if you're just at the same thing for a certain amount of time, it's just, it's not there. Like where you said, like, 310's fine. Let's progress a little bit. Go to 12s, go to 15. Okay, once you've done 15, now you can start to, okay, here, I'm going to give you a heavier weight. We can go back to 10s like that. Yeah, it's not hard to implement, but like you said, like people get comfortable with it. It's kind of that like mid-range loading, but it's typically underloaded. Yeah. Sorry, go finish what you were saying.
Yeah, I think that overall, like 2 or 3 sets of 10 is totally fine. It's not bad. But the one thing that I'll definitely point out, and this is something that drives me a little bit crazy, is if you're looking at the intervention that you've just given them, does it make sense to load with that amount of volume, or maybe you need to regress it, right? So we talked about the quantity
Yeah.
versus quality of movement, right? So
Hmm.
we definitely have our stance
Hmm.
pretty firmly cemented there.
Yeah.
But the other thing is, like, if you are giving someone like leg extensions, for example, that does not need to be like a 3 or 5 rep max,
Yeah.
right? Like,
Right.
it just
Right. Right.
doesn't make sense. You can push those for 10 to 20, depending on what they need it for. Like, I'm thinking of a patient right now. I have her doing like sets of up to 30, and then I'm probably going to progress her higher because she has a chondral defect,
Hmm. Hmm.
and you need more repetitions for a condition like that, right? So
Right.
just understanding like the intervention that you're giving, the purpose of how you're dosing and stuff like that is super important. The same thing goes for like if she's squatting though, that's going to take a whole lot more out of her. If I have her do 30 squats for one set, that is not going to necessarily challenge her quads or her glutes, or whatever. It's going to challenge her cardiovascular
Yeah.
system.
We haven't, we haven't challenged the area that we're looking for fatigue sufficiently. It's different, right? The goal has changed, or we're not addressing the goal.
And the thing is that I find with hitting compounds with that much volume is you don't actually know what is fatiguing.
Yeah.
Like there are too many muscles that are being utilized. You have no idea what is getting an adequate stimulus and what isn't. And that is something that drives me absolutely bonkers, both for in training as well as in managing your patients in the clinic. Because if you don't know what is actually fatiguing them there, you don't really know what your objective was and if it was getting completed. So I think that being able to understand that that's where you can adjust your variables, pull different levers. Maybe you change the load, maybe you change the volume, maybe you can change rest timers and stuff like that, but just make sure that what you're doing makes sense. If you're using a compound movement, it's probably better to use some of your lower rep ranges. If you're doing something that's more isolation or something that is more stable, like a leg press or something like that, it's totally fine for you to push for higher reps. There's not much of an issue there because there's no stability component. So I
Yeah.
think that those
Yeah.
things are super, super important to consider because they just get missed so often. Do you have those considerations? Do you see stuff like that around the clinic as well too,
Yeah,
Mark?
100%, man. I mean, this is kind of how I utilize in my own training as well. Like when we're talking about strength and we're talking about, let's just take strength within a specific movement. We don't have to talk about like carryover to, sports, stuff like that. But I mean, the main driver for strength is going to be your ability to perform that movement, the skill you're building, learning how to, without getting too crazy, recruit more motor units and make that more efficient to be able to produce more force within that movement, right? So if I'm wanting to do that under load, it probably doesn't, I don't need to do a crazy amount of reps, right? If I'm looking to get stronger to be able to produce more force, it needs to be fatiguing under load, which, I'm probably not going to get the correct amount of fatigue or fatigue the right area if I'm in this huge, high rep ranges with a compound movement like that versus like a more stable thing, like you said, leg press, leg extension, curl, whatever it is. There's more room to, it's an isolation type movement. There's more room to, in terms of like higher rep ranges when we're fatiguing that specific muscle or muscle group, right? So I'm certainly taking that into account for patients and, my own training. Yeah. We also have to look at, like I said, it's a goal oriented approach, right? We need to look at like what the person's looking to achieve. So depending on that, we can use different movements, different exercise rep ranges, and things like that. Yeah. So, like I said, it's kind of we're talking about loading strategies in general. Like there's a lot to consider, but once we understand the goal, once we understand what we're looking to achieve, and we have our like baseline set, the variables that you change, it's not rocket science. But if we want to achieve those, we want those adaptations. We're looking to achieve those goals. We have to, know what we're going to change and how we're going to get there. There has to be a plan.
Yeah, for sure. I think having that overarching structure is
Hmm.
so important. Like this is why I find it super interesting to see how some people structure a plan of care,
Hmm.
because it doesn't really get a whole lot harder. Like one
Yeah.
exercise isn't being progressed to be a more harder variation as they continue to improve, right? Like they may just give them a completely different exercise for the same muscle, but it isn't
Right. Yeah.
actually
Yeah. Yeah.
challenging them further. And I think that that brings me to my next question is, how do you look to challenge or make an intervention, or progress an intervention, I should say, when a patient has just been loaded a bunch, or you've kind of like you're like, okay, they're not going to get a whole lot more out of this just by getting stronger. Like what are some things that you usually look for, or that you do to progress an intervention for people?
Now, what is strength still the primary goal? And you're saying we've kind of exhausted, or
Yeah, like so let's just say if you're trying to think of it as like returning them back like to their normal level of function,
right?
right? Like
Hmm.
you've already recovered a lot of their strength. You're How else would you typically progress like complexity for an intervention to make sure that like you're killing two birds with one stone, or that you're challenging them more so that when they return to their like their normal day-to-day life, it's not nearly as strenuous compared to the activities and interventions that they're doing in PT.
Um, can you give me an example?
Yeah.
Yeah, yeah, yeah.
So,
Sorry. I think I know what you're
so
saying, but I want to make sure I answer it correctly. Yeah.
I guess if I were to answer my own question,
Or like, what about like,
like,
give me the presentation that you're saying?
um, yeah. So let's say if a patient
Hmm.
is having difficulty going up and down
Okay.
steps
Yes. Yeah. Yeah.
because they're lacking balance, they're lacking
Okay.
strength,
Okay.
and
Okay.
they also feel like they're going up and down them too slow.
Hmm. And so in this case, you said balance, strength, and speed. So we've addressed
We've their
the strength
power, or sorry,
component.
their strength.
Yeah.
Yes.
So maybe, I mean, so okay, perfect. I get what you're saying now. They're strong. They have the capability to produce that force, right?
Yeah.
They're doing the movement in the way and that is the best way they can perform that movement. Okay, so maybe we can start to address each other variable on its own, right? So we're going to get some carryover to like the balance and maybe the control, the speed component with the strength, but maybe we can look to, if we're taking that specific instance, we can look at the power production standpoint. So maybe they're not going up quick enough. Maybe we can break it down to a single step up with like a contralateral hip flexion, like that, a good powerful march where it's not only going to work on balance, but it's going to work on that power, that speed component as well, right? Um, that's somewhere we can start, right? If we need to break it down even more, if like the stability is limiting them from producing that force and limiting them from being powerful, yeah, maybe it's essentially repetitive single leg stance. Maybe we have to break it down, look at a single leg stance type thing, right? So it's not just the if we're looking at dosing for different outcomes, like we talked about strength, yeah, that speed we need to look at power. You said the stability balance is a little bit different. Does that answer your question? Or
Yeah. So
yeah, yeah, right,
that was pretty much what I was looking for. Is
yeah.
like
Do you want to?
when you're
Yeah, go ahead.
like when I'm looking to progress an exercise,
Hmm.
is like you can really
Okay.
only go so far when it comes to like
Yeah.
adding in more volume, adding in more load. Sure,
Right.
that's you're
Right.
gonna keep getting them stronger. That's fine. I think that having that as like your foundation, totally appropriate. As a patient starts to become more and more functional and they can start to handle more complexity,
Yeah.
that is usually what I'm looking for. So can you remove a base of support? Are they
Mm-hmm.
able to demonstrate control through that? So Mark said, to address like the example that we brought up, is doing a power march, right? Like onto a step. So that's going to help you be able to generate more force It's going to help you be able to stand on one limb for a longer period of time if you're holding that position. And then also the fact that you're exploding through that motion, that's going to help with your power production. That kills 3 birds with 1 stone. That is such a great exercise because it accomplishes so many things that the patient needs in their day-to-day life. And you've progressed that exercise very, very like in a manner that helps them achieve so many things at one time. It's just so efficient. And that's pretty much like what I look to do for a lot of different interventions, is because when you do that, your interventions that you're giving to your patients do not need to be like as vast in nature. You do not need to have 10 different interventions.
Yeah. I mean, I like you said, because when I was that's easy. I gave the right answer. Yes. Like, like you said,
you literally just gave one, and
it was easy. It did everything, right? Single leg stance, power, control, right? And even there's room to regress, there's room to progress. We can regress by doing it on the floor, right? We can do it in a stationary position. We can make it more dynamic by doing it reciprocally on a level surface, and then we can add elevation, right? We can add speed. We can add resistance to that too, right? We can add it, hold it in one hand, right? It throws you off a little bit, right? But yeah, exactly. So like you said, we spent a good part of at least the beginning and middle of this episode talking about addressing strength. Right? There's other variables that are going to contribute to performance of a task, right? So what's it look like? Let's just stick with this example. I didn't know what that exercise was called. Power march. I'm going to make sure I write it as that. I got way too complicated. I would write step up with explosive contralateral hip flexion.
That's what a lot of people will write it as too. So like I usually just say like as a power march or a power step up or anything like that. That's just literally having them with a more explosive knee drive, and then with the opposite arm driving up as well too, typically.
Yeah, right. Exactly. Yeah, I'm with you 100%. Yeah, we're doing the same thing. So we talked about how we're dosing strength. What's it look like when you're dosing that? Is it different than strength? Is it, how do we, within that specific task, and then we can talk about power generally. We talked about how you dose strength. We talked about what we're looking for fatigue-wise. What's power look like?
So for that example in particular, it depends on what their primary goal is and what needs to be addressed, right? Like if it's something that where strength is like good and you're not worried about it, and you're worried more about the power production, then for me, it's like there are 2 main goals I want them to have in mind. A, step up onto the step as quickly and with as much force as you can to generate that. And then lowering, make sure that you're lowering slow and under control. Those are the 2 things that they're probably struggling with if strength has already been accounted for. So if that's the case, I have no issues with loading them a fairly significant amount, and then having them just do anywhere from 6 to 10 repetitions, and that's it. Right. Like I don't need a whole lot, because if you do a whole lot, like you're just gonna make them tired. Doesn't really guarantee that you're addressing the deficit.
Sure. And the movement learning principle certainly applies in this regard as well. Not just the strength. Sure. Yeah. So maybe when they're starting to build it, you're starting low, but you have room to progress.
Yeah, it's a completely new movement pattern, even though it's something that they've been doing. It's just a more complex version of it, right? Like no one walks up the step like that. It's just not normal to to march up a step. But because you're introducing that, give them the same principles that you've used throughout your entire plan of care. Let them explore the movement. Let them learn it. Work on the quality of it. And then after that, start to add on the complexity. Now, the reason why I brought that example up is because I've seen it in the clinic where there isn't a whole lot of cohesiveness when it comes to exercise progressions. It's just, okay, I give you more weight, I give you more volume, and then we kind of call it a day. And that's it. They don't actually progress the complexity of an exercise in any way, other way, shape, or form. They don't remove a base of support. They do not incorporate other variables in there. Like you can challenge someone more cognitively when they're doing a task, for example. Like there are so many different ways that you can make something more complex and still accomplish all the goals that you want to accomplish. It's just something that I feel like people can kind of pigeonhole themselves into if they haven't seen it or don't know that it's like a possibility to do. And that's something that I think is really holding people back and like not helping their patients out when they're trying to recoup some of their higher level skills. All right, Mark. So I feel like we talked a whole lot about loading differences for motor control, for strength, and for power. What do you usually do now, since we were on the topic of power previously? What do you usually do when you are gauging that? Do you capture that as in do however many reps you can do within this amount of time? Or like how exactly are you gauging that?
Yeah, for power, that is.
Yeah.
Yeah, I mean, depends on the person, right? So let's say I'm looking for excuse me, let's say jumping as an example. We'll go back to the step thing too. And maybe the goal is height, right? Then maybe I'm measuring to some degree. I mean, you know, I don't have, at least the clinic I'm at, I don't have like the technology
Force
or
plates?
equipment to be able to measure it that much. But I'm eyeballing it, right? If I want them to say, listen, I want you to jump as high as possible. We're going to do 5 reps. I want you to do it. You know, we're going to do it within this amount of time. Yeah, I'm looking at the height. I'm keeping time, right? I'm looking to see like, okay, I can visually see, you know, the height of your feet or your hand if they're reaching something like that, and I can tell when it's lower, right? So let's say if I'm having them do something more of like a explosive heel raise type thing, right? Similar, I can look at like the height of their toes, something like that. Maybe it's something where I'm having them run upstairs, right? Again, we can use time, right? Or just to be able to track those. So when we're at the higher end or higher level patients, you can use those things. You said if you have like some kind of a system to track like force and height and just power, I guess, which it would track that. Yeah, you're using those. When it comes to something, let's say someone wants to go upstairs quicker, maybe I'm looking at control, right? These are more like, I guess, subjective from my perspective things. I'm looking at how they're able, how many repetitions they're able to, drive that knee to the same height, right? We can assume that if they're losing the height in the march, maybe it's because they don't feel as stable, right? And if they're doing it quickly, if they're doing it forcefully and explosively, and they're losing stability, and they were able to keep that stability and maintain the march height on the non-stance limb. Yeah, stability and the balance is a factor, but that's a way I can gauge, okay, this person isn't as powerful now. This is where we can, maybe do 1 or 2 reps past that just to push into that fatigue. But yeah, that's a way I can gauge it, right? So at least for me, I'm using the visual inspection, depending on what the goal is, if it's distance, if it's height. Yeah, we can take that into account. But it's more of I still try and keep it as objective as possible. Or if I just ask someone like, if you're doing power and you do it till you get tired and someone they jump like 20 times in a row and they continue losing height but they still do it, I don't think the adaptation that you're training isn't power at that point.
Yeah, it's not right? Accomplishing the goal that you're looking to accomplish.
Yeah. Do you do it any differently? Like I said, it's kind of more visual on my part. I don't know. Yeah, how do you look at it?
Yeah, there are some things that I'll do a little bit more visually, like if it is like an introduction of plyometrics and stuff like that. I think that's totally fine. As they start to get more and more for back to return to sport, then we can definitely start to measure stuff. I think that's totally appropriate. For my Gen Pop patients, what I'll usually do is like for the stair example, I will have them go up and down a step and I'll tell them, because like we have one of those like those model stairs where there are
Yes,
like
yeah, yeah.
three different types, and then it's not a whole lot of steps, right? So it's
Quick
not
couple,
exactly, yeah, it's not exactly representative of what you'd have at home, but it at least gives you somewhat of a challenge. So I'll just have them go up and down the steps, and I'll say, okay, 30 seconds. I want you to go up and down as quickly as you can. And then we'll see however many that they get through. And then after that, you have that as your new baseline. And then that's something that you're trying to beat. And then to add complexity to that, I would usually do something like, oh, don't hold on to both handrails, just hold on to one, or hold on to neither, and then see how you do with that. But those are all ways that you can check to see, like, hey, like, what is exactly their limiting factor? Is their power getting better? Is their like speed getting better when they're doing this? You're not exactly looking for force production per se with this, but it's still something that naturally comes by when you're doing an activity. So I think that all these things are great to consider. Something else that I'll do is, like, instead of how many reps can you do within X amount of time, it's how quickly can you do a certain task. Right. So the best example of this is a 5-time sit to stand. You're doing 5 reps of something and you're trying to do it as quickly as you can. I don't usually use that example for athletes a whole lot. I usually use the other one, the former one that I mentioned, which is how many reps can you do within X amount of time, because usually their quality to me doesn't degrade quite as much. If they are shooting for like to do something as quickly as possible, that's when I'll notice like that small deviation or difference between the two directions. I'll notice that their quality starts to degrade a little bit faster. It's usually even on the first rep or two, because they're trying to just do it super quickly instead of actually thinking of like their quality and stuff like that, and trying to get a good motion as many times as they can, instead of just doing something as many times as they can within a time frame. So I think that that's super like nuanced, but it definitely does make a difference in their performance from what I've noticed.
No, I agree for sure, for sure. All right. Anything else you want to add on to today's episode, Kane?
No, I think we ended up covering a whole lot. I think that loading strategies is an important thing that kind of gets talked about. It kind of gets harped on, but it doesn't ever actually get flushed out.
Yeah.
So it's like we all know that PTs typically chronically underload their patients, but they don't actually talk about how to fix the problem. They just say that,
Yeah,
and they
it's
don't
like-
actually tell say like, hey, maybe you should load them this way, or here's how you would progress this, or here's how you can add complexity and like make your treatments more efficient and stuff like that.
Right,
So
yeah.
I think that loading principles and strategies are really important, and we know about them, but we don't know how to fix the problem for the most part, because people haven't spent a whole lot of time actually training and progressing people in that manner. Most of the times it's like you kind of just get stuck in a rut, and I think that's where a lot of these issues kind of come from.
Yeah, and like we discussed today, like there's different presentations that require different dosage, right? So like when you talked about loading and underloading, like I don't think it's the case that people get overloaded, but depending on the person, depending on their goal, depending on what their goal, what they want to improve, and how they want to perform, the dosage is going to vary. So yeah, just to summarize, we talked about loading strategy. We talked about different kind of dosage, how it varies depending on if we're looking to address motor control, if we're looking to address strength, if we are looking to address power. We talked about other variables that we can implement when we're looking at task performance, such as if we're looking to address balance, what's limiting, if it's something, is it a power deficit, is it a force production strength deficit, and we talked about how we're able to manipulate those variables to better serve our patients. Well, that concludes today's episode of the PT Good Podcast. Remember to leave a like, subscribe to us on whatever platform you're listening to us on, follow us on Twitter at PT Good Podcast. Thank you for listening, everyone. We hope you enjoyed. We will see you on the next episode.
Still love you. Bye.